April is Autism Awareness Month, and the California Department of Health Care says 1 in 110 children in the U.S. today meet the criteria for an autism spectrum disorder diagnosis. CDC reports show that the estimated lifespan cost of care for autistic people is between $1.6 million to $3.2 million. Health experts say early detection may be the key to help some of these kids and to alleviate the cost. In her three-part series on autism rates and treatment, CCN's TK Trinidad has more on a pilot program designed to help parents get their kids diagnosed and into treatment.
The number of children with autism spectrum disorder, or ASD, is going up. That's what a recent study from the Center for Disease Control shows. Pasadena's public health director, Dr. Eric Welch, says early detection is the key to helping kids get the help they need.
One of the things we make sure that we push to all pediatrics groups and pediatricians in the city and family doctors is that they do proper developmental screenings on all children. And if you do that, you might be able to diagnose this stuff a lot earlier.
211 LA County has pioneered a pilot program that workers there say detects ASD sooner in children who are more likely to be diagnosed later in life. It's called the Developmental and Autism Screening Program. Executive Director Maribel Marin says the early detection can help get a child into treatment sooner, which she says ultimately decreases the cost of care in the long run.
211 is a national system, and we're one of the largest, if not the largest, 211 in the country. And we started screening families for children 0 to 5.
Now here at 211 LA, we're doing the screening over the telephone using evidence-based screening tools.
Dr. Walsh says catching ASD early and treating it helps children adapt more easily to their surroundings.
If we can get these kids into treatment and therapy, we might be able to actually get these kids to where they actually function a lot better. It really is about really kind of training the brain to be able to express itself another way.
The California Department of Public Health came out with a study that shows for every 10 years increase in a mother's age, the risk of autism increases by about 38%.
The increased risk as a woman ages with a few things, and things like Downs, especially after age like 36, Down syndrome, there's increased risk. And autism seems to follow that pattern, that as a woman gets older, it's more likely that she would have an autistic child.
Today, more programs than ever before are available to help detect and handle autism as research on the disorder continues. Experts still don't know what causes it, but what they do know is that parents worried about their children's development should act quickly.
Well, the good thing is, if a child gets this diagnosis, there are programs. Environmentally, there's probably something. And when that thing is figured out, or those things, plural, are figured out, maybe then we'll be able to get more to the bottom of this and prevent it from happening.
In Pasadena, TK Trinidad, CCN.